All right, Dr. R here, going over another epi question. So let's look at, first off, push pause, take some time to read over the question, try to get the correct answer, the most likely correct answer, and then try to say why each one is correct and incorrect. All right, so let's go in and take a look at the question lead-in and the question stem. And I'm going to review the answer choices. So which of the following is correct in regard to the vignette? So we're definitely going to need to go to the question stem because we cannot answer the question just with the lead-in. So the answer choices are due to chance, sample size is too small, confounding, measurement bias, selection bias. Okay, so this is telling me that this is in regard to different ways of this study is designed. So let's go into the question stem. A group of researchers wants to evaluate the efficacy, so how efficacious a new drug is to treat hypertension. So we have new drug and hypertension. They recruit 100 participants. So we have 100 participants. And we randomly assign them to two groups, okay? So sounds like you might be going experimental and control. One receiving the new drug, and one receiving the placebo. So we would end up with randomly assigned 50 here and 50 there. And then we're gonna follow them for 6 months, it looks like. So this is 6 months. So after 6 months, they measure participants' blood pressure levels. So BP is measured here. And a significant reduction in the drug group, so the new drug group, compared to the placebo group. So these guys had a lower blood pressure after 6 months than the placebo group. So I'm assuming they also probably measured, it doesn't say, but they also measured baseline blood pressures here so that they could see a significant reduction. Now they might group them together and find the mean reduction, right? So whatever the mean blood pressure is here, and then the mean blood pressure is there, and then look at the difference in the means. Or they might do each individual patient and then measure the differences there and then calculate that up. So there's several ways to do that. The researchers conclude that the new drug is effective in treating hypertension. So which of the following is correct in regard to the vignette? So the result is due to chance. Well, we did randomize here, and we got 50 in this and 50 in this. Did we run a p-value? Did we actually test whether or not we could rule out by chance? No, well that's kind of a question. We didn't do if we did mean, we might do a t-test. I don't see anything about a p-value or anything like that, but there is chance involved in here because we did a randomization, so I'm going to put a question mark there. The sample size is too small. Well, we have 50 and 50. There's no real, we are randomizing. There's no real discussion about sample size being too small. I don't see a power calculation being done, which will equal getting the sample size needed. So we don't really know if the sample size is too small. So I'm saying that one is less likely than the result is due by chance. So this one is more likely than this one. So for right now, I can cross that one out. The study has a confounding variable. That might actually be true, but our randomization of these 100 people will help lower the likelihood of having a confounding variable, especially if we design this correctly and we have it blinded by double blinded. It doesn't talk about that, but the randomization helps with a confounding variable, because the confounding variable, so let's say instead of the drug lowering the blood pressure, it was maybe that many of the people in this group had a low sodium diet for some reason. Just the 50 people in this group decreased their sodium, and so their blood pressure went down. So then really it's not the drug, it is the sodium that is causing the blood pressure. But because we did not measure sodium, that becomes the confounding variable. So that's less likely to happen because we randomized. So if we randomized and we knew people were going to do a low sodium diet, or we didn't know, but these people were doing a low sodium diet and we randomized them, it's much less likely that only the people with low sodium diet are going to end up in one group, and that we might have a balance of low sodium diet, which would then cross out and balance them out, because low sodium would be equal in both groups, therefore it's not a factor. So I don't think confounding, because we randomize, is a good option. Study due to measurement bias. Well, that's possibly true. So a sphygmomanometer, they might have been, or blood pressure cuff, right? There might be problems with when we measured the blood pressure in one group versus the other. What if this blood pressure cuff had a wider range of measurement than this one, and this one showed that there were greater decreases because these guys went to clinic A and these guys went to clinic B, or in exam room A and they went to exam room B, and so they were measuring off of a sphygmomanometer that has wider variation, and therefore it showed a lower blood pressure. So that is possible, but I don't hear anything about that in the question stem, so that's really reaching here. So it is likely that this could happen, but I think it's less likely because of the chance. And then selection in the study. So selection bias is going to be balanced out by the randomization. So it doesn't completely rule it out, but it makes it less likely if we correctly randomize these groups and we did this in a balanced way. So it is also somewhat likely that the randomization doesn't work, and maybe we get 30 out of the 50 here, and we get a different balance over here. So we get many more over here out of the 50 that are actually going to make the blood pressure go down. So the salt people versus the non-salt people. And so that is possible, but because we are following good protocol by randomizing, selection bias also says that it is less likely due to chance, leaving us with the most likely or most correct answer being resulting due to chance.